Good afternoon, everyone. Once again, I want to welcome you all to another webinar brought to us by Mother and Child Hospital. And, we're always having interesting conversations every time we meet in such setting. Today is not going to be any different. Our conversation today is also very important because it's something that we often hear about breastfeeding as a natural and instinctive act. But for women, for new mothers, for new fathers, we find that there are quite some challenges, some questions, some difficulties that can come up during the process. So today we're going to be looking at both sides of the conversation. We're going to be looking at the advantages of breastfeeding as well as difficulties that new parents encounter and how we can properly navigate through those challenges. And I'm sure we have our questions ready, both from our new mothers, new fathers, old fathers, expectant parents, as well as caregivers. So we would have that towards the Q&A section. So without further ado, I want us to go through our speaker, listen to the wealth of knowledge that he has acquired. Today, taking us through the conversation is Dr. Anthony Ajeh. He's a specialist senior registrar in pediatrics with over 29 years of experience. Wow, spanning through clinical care, public health, leadership, and program management. He has worked across the World Health Organization, as well as government and non-governmental sectors, both internationally and locally. He's also a member of the West African College of Physicians, and he has his fellowship in view. He also holds a master's in health management, as well as several certifications in epidemiology, project management, and leadership in health. Also been involved in design and implementation of tuberculosis, HIV and AIDS and immunization programs, as well as outbreak investigations and epidemic responses involving polio, meningitis, measles, and acute diarrhea. Very capable hands this afternoon. I expect to be seeing applause. Okay. Can anyone confirm if I'm audible?
Yes, yeah.
Okay, thank you very much. So we're going to be having Dr. Anthony on the floor, and over to you, sir.
Good afternoon, everyone. Please, can you confirm if you can hear me?
Good afternoon, sir. We can hear you loud and clear.
Okay, so I thank you for the introduction. I will just dive into it. Like you said, breastfeeding advantages and common difficulties. It's a common topic. It's something that all of us can relate with it at the family level, and each one of us comes from a family. So why the outline of this presentation will be, as we can see on the screen, starting from introduction to talking about those difficulties in exclusive breastfeeding. So why are we interested in talking about exclusive breastfeeding all over? Again, it is because we all know that exclusive breastfeeding, it reduces infant death, it reduces illness among infants. And when you review some articles across its 6 geopolitical zones of Nigeria, you'll find out that the practice rate of exclusive breastfeeding is actually 46.4%, with an initiation of breastfeeding occurring within the first 1 hour of life of being 57.3%. So we also note that when you're talking about barriers to exclusive breastfeeding, we have a lot of myths, a lot of negative cultural hindrances, and one of them strongly related is the fact that women lack family support when they are when they are breastfeeding. But one of the reasons why we are doing this presentation today is the fact that when you speak to women, you find that for those who are doing exclusive breastfeeding, engagement with healthcare workers, regular engagement, and the feeling of, yes, I can do it, that is fostered by such engagements actually help in beginning exclusive breastfeeding. So I would like us to review the anatomy and physiology of the female breast. I will not dwell much on this because I know so that I do not bore my audience knowing that we are a mixed audience. We know that the female breasts are accessory organs of reproduction in the females. In the males, of course, they are rudimentary. And during pregnancy, the progesterone and to a little extent estrogen that is produced actually enhances breast development and milk production. This continues until after birth, and 1 week after birth, you still have prolactin from the anterior pituitary gland continuing to stimulate breast production. Very importantly, I want to take from this anatomy and physiology of the female breast is the fact breast consists of 20 lobes. The breast, of course, consists of glandular tissue, fibrous tissue, fatty tissue. But I want us to appreciate that each breast has 20 lobes, and each of these lobes has alveoli, connecting dots, linking to the nipple. So you hear a lot of our women saying that because I have small breasts, so I do not have enough milk production. So I just want us to demystify that by saying that since we have 20 lobes in each breast, we have enough tissue in each breast, whether it is big or small breast, to actually breastfeed our newborns. Each of the dots leads to the nipple area, and it is good to note that the nipple area is surrounded by an areolar tissue which has glands, that dark part that surrounds the nipple in females, and that helps to make it soft and enhance latching of the babies during breastfeeding. It's good to note that during pregnancy, the breast responds to the high circulation of estrogen and progesterone by increasing production of milk, increasing the size of the breast tissue. There is also production of prolactin, which helps in milk secretion, and this increases throughout pregnancy. The prolactin is produced by the anterior pituitary gland and acts on the gland of the breast. As soon as a child is born and he begins to suckle, he or she begins to suckle at the breast, there are receptors in the nipple and the areola which stimulates sense a stimulus to the hypothalamus, and this stimulates the produce prolactin and the posterior pituitary gland to secrete oxytocin. That oxytocin is carried to the breast. This oxytocin will act and stimulate the myoepithelial cells around the breast to contract and eject milk from the alveolus. So the thing that a child suckles at the breast is the stimulus that allows one for more production of milk, also allows for the milk that is already in the breast to be let down into the child's mouth. This breastfeeding, prolactin secretion is better produced at night. So when a woman breastfeeds at night, and we actually advise women that if you can do extra breastfeeding at night, it actually helps to keep a good supply of milk within the breast. So the key things to know from here is the more a baby suckles, the more milk is produced. And if a baby stops suckling, or if it never starts, the breast will stop producing milk. The fact that the milk is evacuated by an infant sucking actually encourages milk production, because we also know that the presence of excess milk in the breast automatically stops that breast from producing milk. Again, it is noteworthy it is good at this point to insist that if there is a twin gestation and both twins are suckling, what happens is that there is extra production of milk, and which can satisfy those two babies within the entire period of 6 months that we advocate for exclusive breastfeeding. So what is the composition of breast milk? We have water, protein, carbohydrate, minerals, vitamins, and other components that we will soon see. But I want us to note at this point and catch this, that 90% of breast milk is actually what? Water. So advocating that, look, the child might be thirsty, is just taking breast milk, there's no water, that we hear mothers say does not hold true in science, because we know that 90% of the breast milk is actually water. What are the other components? We have immunoglobulins. These immunoglobulins are actually anti-infective factors. They also help in preventing allergies in this infant, especially the very early milk that is produced, colostrum. So the fact that a child is being breastfed means that the child will not be exposed to allergic factors that will come from cow milk and its protein thereof. The fact that we have anti-allergic factors such as the immunoglobulin that helps the infant means that breast milk helps to prevent a child from having allergic challenges. Some other factors that are employed in breast milk include lysozymes, which helps to destroy bacteria, lactoferrin that binds iron. A lot of our microorganisms need iron for survival. So that agent in breast milk, lactoferrin, helps to bind iron and so starves the microorganism, so we do not have infection. Other factors that are in breast milk are growth hormones. We have epidermal growth factors and insulin-like growth factors that help to stimulate the digestive tract and to quicken their maturity, and so create a barrier for the child to ward off infections. And we also have bifidus factor that helps to multiply harmless microorganism in the gut. The lactobacillus is a good example. And so, because it is over multiplying, we do not have types of microorganisms that will cause trouble for the infant. Just to mention that colostrum, the fall milk, is the first milk secreted after birth within the first few days of life, up to about 2 to 3, 4 days. It is yellow, it is thicker than the hind milk. It differs from the hind milk, contains more protein, more immunoglobulins. Of course, it has less carbohydrate content, very rich in vitamin A. So this colostrum, I'm pointing it out here in this presentation because a lot of our women will call it dirty milk that should just be expressed and thrown away. However, science has proven that it is a very important part of the milk that we need to take. It acts as a laxative. It helps to prevent jaundice. And then, of course, it is an anti-infective, it has an anti-infective protection for most of our babies with its high immunoglobulin content. So what is breastfeeding? We are now coming home to our presentation. It is the feeding of babies and young children with milk from a woman's breast. Of course, it is the most natural way to feed our infants. It's even a mother and her baby. Now, based on what we find in consulting rooms, talking to mothers, you'll find that there are types of breastfeeding that we engage in as breastfeeding mothers. One is token breastfeeding. Here you find a woman who the child immediately after birth. And after that, she begins to give artificial feeds and food throughout the entire lifespan of that child as an infant. We have mixed or partial feeding, where the woman feeds the baby with some breast milk and some artificial milk also. So you may call it about a 50-50 breast milk and artificial feeding. And then we have predominant breastfeeding, where most of the time the baby is actually fed on breast milk. However, the mother gives water or some other forms of artificial feeds occasionally. And then we'll take some a type of breastfeeding, full breastfeeding, when it is either a predominant breastfeeding or exclusive breastfeeding. So what is exclusive breastfeeding? It is giving the baby no other food or drink, but just breast milk without addition of water. Of course, where we have prescribed medicine, vitamins, or mineral drugs, it is still exclusive breastfeeding. So we'll now go to what are the benefits of exclusive breastfeeding? When we look at these benefits that I'm going to read out to us, you will find out that exclusive breastfeeding benefits the baby, it benefits the mother, and it benefits the community. Take, for instance, for the baby, it is food in the best natural food with the best component in the proportion for the growth of the baby that breast milk represents. There's no other feed that comes close to breast milk in terms of providing the nutrients in the right proportion and in the right mix for the child's development. It is protective to the child, to the infant. It enhances the educational educational performance of the child by giving him natural intelligence. For the mother, it helps the woman to space her pregnancy. It helps the woman to bond to her child. It helps the woman actually to prevent against some forms of cancer. For the community, you'll find out that exclusive breastfeeding is actually less expensive than artificial feed. Most of the artificial feeds that we have are produced and imported into the country. And so when we buy things of cans of artificial feeds, what we are doing is that our capital assignation as communities flies to those countries that produce the artificial milk for us. But let's go through it one by one. Breast milk contains all the nutrients an infant needs in the first 6 months of life. It has the protein, it has the carbohydrates, it has the lipids, it has the vitamins, the mineral mix. Even beyond that, it has anti-infective agents like we have listed, the immunoglobulins, the lysozymes, all the enzymes, that all the ingredients that are needed to ensure that this child grows well are in breast milk. And so there is no better feed. And all that has been done with artificial feed production to try to get close to breast milk, we have not succeeded as humans up till now to get that right mix of breast milk to be produced as artificial formulas for babies. Breastfeeding also makes a child less likely to suffer from serious infection like respiratory tract infection, gastroenteritis, diarrhea disease, and of course, children who are breastfed are less likely to have allergic conditions such as asthma and eczema. It has been found to reduce overweight and obesity in children. Exclusive breastfeeding when we practice exclusive breastfeeding, some of the benefits include the fact that we have a large amount of vitamin E, which prevents these children from having breakdown of their red blood cells easily. So we increase the lifespan of the red blood cells, which we call erythrocytes. In breast milk, we have the right ratio of calcium to phosphorus 2:1. Most formula milks, that ratio is reversed. And because of that, we have issues with calcium absorption with infants who are artificially fed. So with breast milk, we also have omega-3 fatty acids, cholesterol, and taurine, which are very important for brain growth, regardless of the diet that infant is actually placed on. We need to emphasize the fact, especially in our country, that breast milk is more hygienic and is cheaper. If you want to go to artificial milk, you may need, within a space of that 6 months, up to at least 40 cans of artificial milk before a child can be fed optimally. And when you talk about 40 cans, you are looking at something in the region of, if it is a budget artificial feed that you want, you are talking of something in the region of about 400,000 naira to feed your child within a space of. So what are the other things that exclusive breastfeeding gives us? It improves the child's immune defense mechanism and supports adequate growth up to 6 months. And in addition to this, exclusive breastfeeding has been found to promote, when compared to cow milk and certain other adapted preparations, to have the right mix of electrolytes, which helps us to avoid electrolyte deficiencies and issues around electrolyte derangement when compared to artificial feeds for our newborns. What are the techniques that we are going to use for breastfeeding? When we have a newborn, we need to teach most of our mothers that they could breastfeed either sitting up or lying down on one side. It is important for the child's mouth to be open and with the chin touching the breast of the mother. The lower actually called outwards so that the baby can latch onto as much of the breast tissue as is possible so that the nipple is free within the mouth and the milk can flow in. So when you have a good latching, a good technique, you will see more of the areola of the mother above the baby's upper lip and less below. Now, it is important that the baby is not allowed to latch onto the nipples and bite, because if that happens, the process becomes painful to the mother. The child is not taking in any of the breast milk, and so he gets more furious and even begins to bite on the breast, on the nipple more, causing more pain, and everybody gets the mother gets uncomfortable, child is uncomfortable. So the correct technique would be that there is a latching onto most of the areolar space, the breast tissue, and so that the nipple is slightly free inside the mouth of the baby to allow the milk to go into the child's mouth. And when you are doing that, as a mother, you actually hear the sound, you feel the sensation of the milk leaving your breast, and the child, you hear the sound of swallowing that the child is also making. So you will know that there is a good latching that has occurred. Very importantly is the fact that when we want to detach a child from the breast, we do not need to pull the child forcefully from the breast. All you need to do is to pass your fingers into the corner of the mouth between the gums, and that will break the suction, and then you can release the child from the breast if you so wish at that time. It is important to note that the child needs to finish suckling at one breast, empty it before you move to the next breast. Usually this takes about 10 to 20 minutes. What are the preparations that we do to commence exclusive breastfeeding? We need to, before birth, we need to, between 30 weeks to birth, when we shower, we need to clean, dry the nipples very well, and rub lanolin. And if we do not have lanolin, maybe a Vaseline, and then draw the nipple out so that it will become protactile, and rub it gently in between your finger and thumb. And then at birth, we need to establish early skin-to-skin contact between mother and the baby, which is known to stimulate breastfeeding. And breastfeeding should be initiated within 30 minutes of birth, ideally, or within an hour, and to ensure that we breastfeed both day and night. So what are those difficulties with exclusive breastfeeding that mothers complain about? One is long nipples. This can lead to poor feeding because the baby is only able to maybe latch or grasp at the nipples. The mother must be taught that the baby needs to latch to the breast tissue more and not to latch onto the nipples, because like we have said, that will cause discomfort and the baby will not be able to even get anything out of the breast. So in some women, they complain that their nipples are short. For this, the woman will need assurance when you get to your facility where you are having your antenatal care, or you come for checkups. The nurses, the doctors, we can teach you that all you need is for the baby to latch onto the breast tissue more than onto the nipple. So for you. You could have a child who is very small and the nipples are very large for him, feels the whole mark, is not able to latch onto the breast tissue. In this case, the mother will need to express the milk and feed the baby with cup and spoon, pending when the child grows to the point where he is able to now latch onto the breast tissue and ensure that adequate suckling can occur. Other difficulties are that of an inverted nipple or flat nipples. In this case, again, the woman will need to express the breast milk and feed the baby before latching can start occurring. As we are using the breast milk pump to express the breast milk, you will notice that in most cases, the nipple becomes protactile and the baby will now be able to latch onto the breast properly. So first of all, we express the breast milk, feed the baby on the breast milk. As we're using the breast milk pump and the nipple becomes protactile, the baby can better latch onto it as the days and weeks roll by. Some difficulties mother will complain about that we see are cracked or sore nipples. This usually is as a result of poor techniques of breastfeeding and latching of babies. It could also be the result of infection with oral thrush that could occur in newborns. When this occurs, we'll need to dry the nipple again and wet it with even breast milk and allow for healing while we are expressing and breastfeeding the the baby. We could also, at the same time, if it is proven that it is oral thrush candidiasis, treat for candidiasis and the problem of sore or cracked nipples. With inflammation of the breast, we will continue breastfeeding, and we do not stop breastfeeding because there is an inflammation of the breast that is ongoing, but you will need to come and see the doctor in the facility for an evaluation. For breast abscess, when you see a breast abscess, please, you will need to come to the hospital and be evaluated and treated. You might need to have an incision and drainage done and given antibiotics. When you have a breast abscess, you will not need to breastfeed a child from that particular breast until the treatment has been offered and that abscess has resolved. In cases where you have breast engorgement, it is usually as a result of the fact that adequate evacuation of the milk by suckling of the child has not occurred. This is when the child is put to breast. In the event that even when the child is put to breast and he's suckling and it is not relieved, we could use a breast milk pump to gently express the milk, and that will resolve breast engorgement. When a woman has poor health, usually have issues with supply of milk for the baby. And when this happens, we need to get the woman properly treated. And it's at this time, it is good to note that we will need to support every woman who is breastfeeding. She must be in her best of health and take a balanced diet. Generally, when you meet our breastfeeding mothers, you will hear of them speaking to the fact that there is inadequate production of or supply of milk from the breast. That's if the woman is maintaining adequate breastfeeding technique, it could mean that maybe there is a maternal illness that we need to dig into and uncover and treat. Sometimes when she has lost a twin, the emotional crisis could actually be the reason why she is not producing enough milk. Anything that causes the woman to be emotionally unstable will actually impact her milk production. A lot of times, the woman does not have privacy to breastfeed, and that's the reason why she is not really having adequate production, because unless the child suckles, like we have earlier pointed to, there will be not enough milk production in that particular breast. So all we need to do is to ensure that women have adequate, sufficient rest. And we usually advise women that when the child has kept you all through the night breastfeeding, that's good. But when he is not sleeping during the daytime, you must also find time to sleep when the child is sleeping, so that when he is up and making demands to suckle at the breast, you will be able to meet up to that demand. So there are difficulties that could also occur with cleft lip and cleft palate. These are difficulties that usually doctors have to come in to resolve. With cleft lip, we know that the latching will not be complete. That's because it's not complete. That airtight mechanism that a good latch provides, and you can actually air does not get sucking, does not happen with cleft lip. Of course, with cleft palate, there's no way the child can suckle. Of course, there are hospitals where we use on our palatal obturator to close as a temporary device, and the child will suckle. But it is only after a surgical intervention that that child will be able to suckle. We usually use a feeding tube with a long nipple to feed this child express breast milk. So some of the myths that women talk about that are militate against exclusive breastfeeding is that it will it will damage their figure and cause their breast to sag. We found out that this reasoning is not true. All breasts will eventually sag with age. Some will tell you that when they breastfeed, their sexual arousal and desire diminish. We found that it is especially those who are scared of pregnancy, and it is good at this point to say you could just start a family planning option for yourself so that releases that emotional instability from you, and you could actually breastfeed the child properly. Some might is that if the breastfeeding mother cannot have sexual intercourse with her husband when he interfere with the milk. Again, that is not proven to be true. There is no scientific basis for that. Some say that the breast will go sour if not given to the baby for a day or two when the mother has traveled. Again, this is not true. Breast milk, we say that the child cannot thrive unless he's only breastfed is only fed with artificial feeds. Breast milk is not enough. It has been proven over and over again that breast milk is enough for the child in the first 6 months of life. The child can suck blood instead of breast milk if he's being breastfed for several months up to 1 year. Again, this is untrue. The WHO has found out that we can breastfeed a child up to 2 years of age. And of course, we've talked about that. The breastfeeding can spoil a woman's figure and cause the breast to sag. So in conclusion, I want to say that we have plenty of benefits from exclusive breastfeeding, and we need to continue exclusive breastfeeding. Well, our high awareness, because most mothers know about exclusive breastfeeding, we need to translate it into practice, and we need to continue this kind of engagement we are having now so that mother will have that self-awareness that they can do it on their own, and breastfeeding is not as problematic as some will want to put it. So thank you. I will now yield the floor to the moderator for questions.
Thank you so much, sir. I think we can all agree that this was incredibly practical, very insightful, and very relatable. Thank you so much, sir, for sharing from your wealth of knowledge. And not surprisingly, we already have a couple of questions in the chat box, and I'll be reading out shortly. Feel free to also drop any other question that you might have, and we would address it as soon as we get to it. So the first question says, thank you, doctor, for the educative presentation. What could be the reason behind some mothers reporting that their infants are not adding adequate weight despite having adequate breast milk production? He also asks that, okay, the reason why the quality of the breast milk itself is poor. So what could be responsible for infants not having adequate weight despite adequate breastfeeding, and why the breast milk quality could be poor? Over to you, sir.
If I heard the question well, uh, it's saying what could be the reason why children do not add adequate weight while they are being breastfed?
Yes, sir. And why the quality of the breast milk in itself could be poor. So some mothers get reports that the quality of breast milk they are producing is poor.
Okay. If, just like we have stated earlier in this presentation, we found out that breast milk contains all the nutrients in the right mix for every child. Those who are breastfed actually have better weight gain. So I will want to know where this particular baby is that is being breastfed and not gaining weight adequately. I think that child and mother should visit a hospital so that we can unravel what could be wrong. Is it the breastfeeding tactics? Is the child not taking enough in? If the child is taking enough in, are there underlying health issues with both mother and child that we need to unravel and treat so that this child will be on the right trajectory for weight gain? But as for breast milk, if you are doing practicing the right technique, exclusive breastfeeding, all babies actually add very good weight all through the time that you are practicing the exclusive breastfeeding. The breast milk is enough for them within that 6 months span. Thank you.
All right, thank you, sir, for that affirming answer. We have another interesting question, and it says, how long can breast milk be stored in the freezer? And do we need to buy a cooler or food flasks so that the food in the freezer does not contaminate the breast milk?
If I can hear that again.
How long can breast milk rather be stored in the freezer? And do we need to buy a cooler or food flask to put the breast milk in so that it doesn't get contaminated by other food items in the freezer?
Mm, if you want to store breast milk in the freezer, okay. Now there is a fridge section which the temperature is at about 4 degrees centigrade. The freezer section will be about minus 8 to 18 degrees centigrade. So if you are going to store breast milk in the freezer, you could store for as long as months and then use the breast milk. One, if it becomes, if it is a freezer, it will certainly become iced. And then once it thaws and becomes a liquid, you use it immediately within about 1 to 4 hours, not beyond, because you know when you freeze and and you cannot refreeze it again because you might denature the protein which are beneficial. Well, if it is in the fridge section, you can refrigerate the breast milk for some days and then bring out and feed the baby. And if you are storing the breast milk outside, you could actually you have it for 6 hours. So it depends on where you are storing the breast milk, the temperature, and whether it is solid now, as in ice, or it is in liquid. That determines how long you will be able to use your breast milk. And if it is an express breast milk that you have started serving the baby and you are using cup and spoon, because the baby actually have saliva, you cannot use that. Even if you want to save it, you can't save it and reuse beyond 4 hours. Remember that the saliva from the baby will have contaminated that express breast milk. I'm just trying to answer as comprehensive as is possible for any other question along that line. Thank you. And I think generally when you want to store express breast milk or colostrum, you must maintain the highest standards of hygiene. So yes, if there are other foodstuff within that freezer or fridge compartment that could contaminate the breast milk, you need to move it out. Yes.
Thank you so much, sir. That was really comprehensive. There's another question here that states, for a woman with breast lump, can the lump be removed during breastfeeding, even when it is not paining the woman?
Now, a woman with breast lump, it will depend on what is causing the breast lump, right? What comes to my mind is, I hope this particular lump is not due to poor feeding technique and there is blockage of that particular duct. But this is somebody that will need to go to the facility and the doctor will evaluate. And then depending on what is causing this particular lump, that will determine the approach that we are be adopted in the management of this. So it is not, one cannot give one answer that fits all. It will be individualized to what is causing that particular.
Thank you, sir. That was quite direct. I have another one asking that she has a 2 months old baby, but she's not lactating very well, and she often has to rely on formula. So she's asking what she can do to improve her breast milk production.
Okay, so what she can do to increase her breast milk production is, one, put the baby to breast every 2 to 3 hours. So that means 8 to 12 times in a 24-hour cycle, your baby is suckling at the breast. Two, ensure that she has enough rest and she's not exposed to or resolves every emotional distress that she could be exposed to. Three, ensure that she applies or seek the advice of a lactation consultant or comes to the facility so that we can teach her how proper breastfeeding technique. So if all these problems are resolved, her lactation should ordinarily improve.
Thank you so much, sir.
Thank
We
you.
have another one that is asking to summarize what can be done if a new mom does not produce milk on time after about 1 to 3 months post delivery.
What can be done if the newborn order?
A new mother is yet to
Okay.
produce milk, yet to start lactating after about 1 to 3 months post delivery.
Okay. Obviously, there is a problem with the woman who was not able to lactate even immediately after delivery. So we need to know what those problems are before we can resolve the problems. So how prepared was she to initiate lactation? Was there a counseling session, a health education session that was given to her during the antenatal period? Was she herself aware that she needed to do exclusive breastfeeding? If she was aware that she was supposed to do exclusive breastfeeding, what happened in the first 1 to 2 weeks? Those are the issues that we need to uh, uh, unravel to know why up to 3 months she has still not started lactating. Unless we can unravel, do a deep dive and unravel those particular issues in the first days and week of delivery, then we'll understand better. Now that the child has been placed on artificial milk for 2 to 3 months, already both mother and baby have adapted to artificial milk, and I'm sure that is why it's beginning to be difficult for her now to revert back to proper lactation. So, in preparing for the next child, if that is within her plan, is that within the period of antenatal, we'll need to tell her that there is something called exclusive breastfeeding, and it is beneficial. Exclusively breastfed and derive all the nutrients from exclusive breastfeeding in to ensure adequate nutrition and growth of the child. And with all the benefits that we have listed, those benefits can be gotten by both mother, baby, and the community. And then the process of commencing should start within 30 minutes. And if you start lactating within 30 minutes, if they have issues, then we'll be able to delve into those particular issues. If their latching is not proper, if they're sitting and holding the child to the breast milk is also not proper, we can resolve that. So I think it is there might be particular issues that have brought us to this point that 2-3 months after delivery, she is not able to lactate, and we need to delve into those particular specific issues before we can unravel or those particular challenges. Thank you.
Thank you, sir. We have another question here that is asking, what is the feeding interval for a new time mom and a newborn at night for a baby who sleeps the
Okay, I
standard
didn't
of the
get.
required feeding interval?
Okay, if you can repeat it, the question, please.
All right, sir. For a newborn and a first-time mom, what is the feeding interval, especially at night, for a baby who sleeps without waking up?
Okay, we will say that every 3 hours or max every 4 hours, a child should be breastfed. I do understand the issues with night. That's why I would say at night, you can every 4 hours because the mother might be tired. But we know that most newborns actually, they have a reverse circadian rhythm that they stay up mostly at night. So I will be, they stay up mostly, they are more awake at night and breastfeed a lot at night. And that actually helps to keep milk production at optimal levels. So newborn women with newborn babies, so we tell you that they didn't sleep well at night because the child kept them up. But if this particular baby is a little bit more sleepy than I would advocate a 3 hourly feed. It's is better at most 4 hourly at night. But if she noticed that this baby is still that sleepy in the daytime, please, this baby will need to be checked in the hospital. Let a pediatrician evaluate this particular baby. Thank you.
Thank you, sir. The next one asks, when feeding breast milk using a bottle, what is the quantity, what's the baby?
Sorry, I
So
didn't
that's
get.
okay. So this person is asking for the expected quantity for expressed breast milk given via a feeding bottle.
Okay. So usually for a newborn baby in the hospital environment, we will tell you that if we are giving again, it depends on the age. Usually, we want to get to a point where the child feeds on demand, where we are not rationing the breast milk for the child. So it feels until the child feeds until he does not want to take again. But if I'm taking a child of, let's say, with 3.5 kg, I want the child to have about 350 mils of breast milk within a 24-hour period. So I'm just doing a rough calculation now because of this question. So if I have a child that is 3.5 kg divided by 12, and I want to ensure that at least I feed this child with 100 mils per kg. It means that I will be giving this child something like 30 mils every 2 hours of express breast milk. By the time I reach that in the first 5 days of life, I will be increasing by about 1 or 2 mils every 2 hours until I reach a point where I know that the child can no longer take, or he can no longer, he gets to that point and it to take more. So ideally, for a child with a weight of about 3.5 kg, I will want to feed express breast milk about 30 mils every 2 hours. I hope that answers the question. You can let us know using a hypothetical weight.
Yes, sir. So I have two last questions. The first one states that what are the causes of vomiting after breastfeeding? And the second one states that can someone start exclusive after 1 month of mixed feeding?
I got the first question, but the second question I didn't.
The second question is, can someone start exclusive breastfeeding after 1 month of mixed feeding?
Okay, I'll start with the second question. Once you have once you have done mixed feeding by 1 month, it's no longer exclusive breastfeeding. But is it beneficial to continue feeding the child only breast milk after you have done mixed feeding? I will say yes. That you can just at this point just go on only breastfeeding until you reach 6 months when you commence complementary feeds. You introduce complementary diet. The first question, most of the time that people's mothers say that the child vomited, it was actually a regurgitation that happened. And the reason why it happens is that the child's sphincter, there is a sphincter that we have between our gullet or esophagus and our stomach. It's not well developed in children. That's why anytime you have finished breastfeeding a child, you keep the child at the shoulder and continue rubbing the back until you hear the child belch. Because if you just lie the child on the bed immediately after in order to do some household chores, especially when the child has already started breastfeeding or started sleeping, which they usually do after they are well fed, you will notice that the child might just regurgitate. You will call that vomiting. For most times, it is a regurgitation. It was not actually a vomiting that has occurred. And even after the child, you have burped the child, he has belched, and you are putting the child to bed. Ensure that you are putting the child at an angle of 30%, 30 degrees from the horizontal. The head is up so that he does not, that gravity is ensured so that the content of the stomach does not go into the esophagus and the child will regurgitate. I hope that answered that question.
Yes, it does, sir. We have one question. She's asking if she can give water to a 2-month-old baby since she's feeding via formula.
Okay. So for us, we do not want to hear of giving water in the first 6 months. We want to hear about exclusive breastfeeding. All true. But if a woman who is feeding her child with artificial feeds, I don't know why. If she wants to, I won't. Especially in our country where we do not want to give water, is a source of our water most of the time. So and their immune system is not developed yet. Their integrity mature. So any small microorganism in the water will bypass the barriers and enter the bloodstream, and you see a child coming down with infection, sepsis. So as much as it's possible, I would say exclusive breastfeeding, no water within the first 6. This child is has passed that period of 6 months, and we are bringing in complementary diet. But if you must give water, since you're already doing artificial feeds, then please ensure the hygiene. Whatever water is properly boiled under your direct observation. Thank you.
Thank you, sir. Another one was dropped in the chat section. So this question is asking if breastfeeding is
I didn't get that. If breastfeeding is
contraindicated in pregnancy.
okay, no, breastfeeding is not contraindicated in pregnancy. For instance, if perchance you have a food and you find that you are pregnant already, you can still continue breastfeeding that your infant that you have already that is breastfeeding. Please do not stop, because we found out that stopping to breastfeed those infants is one of the causes of malnutrition that we see commonly in our community. So yes, you can breastfeed even while pregnant.
Thank you so much, sir. Once again, I think we can all agree that this has been incredibly insightful. For more access to our health information, practical tips, updates, or services offered by Mother and Child Hospital, feel free to reach us via the links that have been shared in the chat box. And if you also have any other questions, feel free to use the same link as well. Thank you so much, Dr. Anthony, for joining us today and sharing from your wealth of knowledge. We appreciate your time and your effort. And to everyone who has joined us today, thank you for spending part of your day with us, for your questions and your contributions. I hope this conversation has helped to reinforce and to remind you about the benefits of breastfeeding and how to navigate the challenges or the difficulties that new parents, or caregivers commonly face. It's been a pleasure having you all with us, and we look forward to seeing you at the next webinar. Have a wonderful day, everyone. Thank you.